I'm Angelina Rose. I'm the patient.
I'm Janie. I'm the nurse.
I'm Anna, and I'm the educator and sister. I'm Dr. Haynes. Hello, today we're going to meet with patient Angelina Rose. She's a 27-year-old patient of Dr. Haynes and nurse Janie, who's been diagnosed with a terminal illness of glioblastoma multiforme. Let's go meet our patient.
Hey Angelina, how are you feeling?
Not so good.
Can I take a look at your bracelet? Can you tell me your name and date of birth?
Angelina Rose, 10/24/91.
Perfect. How's your head feeling?
Not good.
Not good. What would you rate that on a scale of 1 to 10?
Probably a 12.
A 12.
Yeah, she had a pretty rough night last night.
Really?
A lot of throwing up and just her words are becoming more slurred, I feel like.
Goodness. Do you need anything for nausea? Is there anything I can do for you?
Mm-hmm.
Okay.
I think someone came in a few hours ago and gave me something, but I don't know, it's getting worse.
Okay.
I haven't thrown up yet, but I feel like I'm ready to.
Okay, I'll work on getting you some Zofran or something to help with that nausea.
Did you want to talk to her about what you were talking about earlier?
Is there something on your mind?
Well, so I've talked to Dr. Haynes before, but I think that I want to talk to him again, possibly of doing the death with dignity. Because I mean, I've been through surgery, I've been through all the chemo treatments and radiation, and it's not getting any better. And I know I don't have much longer, and I don't think I can live the rest of the few months that I have
Okay.
feeling the way I do.
Okay. Have you thought about palliative care or home with hospice? I know you're getting discharged soon.
Yeah,
So.
we've talked about it, but I don't want to go through all that. It's
been a rough 2 years for our family. She's
Yeah.
been really sick, not able to work, and it's taking a toll on her.
Okay. So for death with dignity, there's criteria that you have to meet. You have to have a terminal illness, which
Check.
glioblastoma is a terminal illness.
Yeah.
You must be able to administer the drug yourself. So if that's something you're wanting to look into, we kind of have to jump on it before this gets too serious with the glioblastoma. And you have to make 2 verbal requests, and these verbal requests have to be 15 days apart. So you need to bring this up to Dr. Haynes twice, and then 2 weeks apart. And you have to have two witnesses, and one can be family and one needs to not be family. Does that make sense?
It does.
And you have to have, Dr. Haynes has to verify the order, so he has to be comfortable with allowing you to do that.
So do we need to talk to Dr. Haynes too? Should we?
Yeah, I'll page Dr. Haynes and we'll get him on the same page.
Okay.
Is that okay?
Sounds good.
All right. Let me know if you need anything.
Thank you.
Hey Dr. Haynes, I know you're taking care of the patient in room 406, Angelina Rose. She's the patient with terminal glioblastoma. She was diagnosed October 2016, and it's been brought to her attention that she only has 6 months to live. She brought up to me the death with dignity. I educated her about palliative care and home with hospice, and she's really leaning towards the death with dignity. So I told her that I would get you on the same page. I educated her about the strict criteria she has to meet, and she's willing to go through with that. Her sister's at bedside and seems supportive of her. She is having severe headaches, nausea. She has had the tumor removed in the past, and it has quickly come back. So I just let her know I would get you on the same page.
Physician-assisted suicide, commonly known as death with dignity, is a process by which adults who are mentally competent and terminally ill are able to voluntarily request and receive a prescription medication to end their lives in a peaceful and humane manner in a place and time of their choosing. According to the deathwithdignity.org, this is a process often referred to as mercy killing and is legal in states such as California, Colorado, District of Columbia, Oregon, Vermont, Washington, and in 2019, Hawaii will become a part of these states as well. These states require that the patient provide proof of residency, depending on whatever state they live in, are 18 years of age or older, and are mentally competent and capable of making and communicating their own health care decisions. They also have to be diagnosed with a terminal illness within reasonable medical judgment, and of which diagnosis will lead to death within 6 months. 2 physicians must determine that all these criteria are met and that there is a formal process that has to be followed. It's important that you discuss these end-of-care life decisions with your physician, even when you're healthy. If your physician doesn't have the same morals and ethics as you and determines they do not want to be a part of this process, you can secure another physician. Because this process takes 3 to 4 weeks, you want to make sure that your physician is on board with you from the beginning. It is important to note that your physician does not have to participate in this if they do not wish so. Oftentimes, physicians and nurse care practitioners and other healthcare providers do not find this to be ethically sound with them, and so oftentimes they'll request that you find another practitioner that will aid you in this process.
Hey, Miss Rose.
Hey, Nurse Janie.
How are you feeling?
So good.
Are you still nauseated?
Yeah, I feel like I'm gonna vomit.
Okay. Well, I got this Zofran for you, so hopefully that'll help. Yeah. And I paged Dr. Haynes for you, so she should be in here shortly.
Good.
Ooh,
I'm sorry. Ever since I've been diagnosed, I've just been so clumsy.
that's okay. I'll get you another one. Where's your sister?
She's out smoking somewhere.
Okay.
Go figure. I'm sick and she's out killing herself.
Hey, Miss Rose, how are you doing?
That's so good.
So what's on your mind?
Well, so as you know, I was diagnosed about 2 years ago, and I've been through chemo, I've been through surgery, and it's not working. I know I don't have a lot of time, and I don't want to spend the rest of my few months that I do have just getting worse, and it's bad now, and like right now I have such the worst headache. So I mentioned to Nurse Janie that I was thinking about doing the Death with Dignity.
Has anybody talked to you about hospice or palliative care?
Yeah, I did a lot of research about it. My sister and I, we've talked about it, but it's not the route I want to take.
Okay. I'm just going to educate you just in case, just to give you some education so you'll have that in your mind. Hospice, you can do at home, and is for terminally ill within 6 months, and usually there's no curative measures. It's just more trying to keep you comfortable. And then palliative care, they can still do curative measures if that's something you want to think about maybe. And then so the Death with Dignity, you have to make your first verbal request, and I think you did that today, so I'm gonna document that. And then within 15 days, you have to make another verbal or written request. You can send me a letter to my office, and once I get that request, I get it documented. Within 48 hours, I can write an order for the medication. But the thing about it is you have to administer the medication yourself. So it'll have to be done at home. Your family can't do it. You have to do it just because of legal and by law in Colorado. That's what it is, okay? And then so I have to get another doctor to look over your case. I'm gonna talk to Dr. Green, and then we're gonna try to get this process started for you. If that's what you want to do.
That's good.
Okay. Do you have any other concerns?
No, I don't think so. But if I do, I'll let you know.
Okay. I'm gonna give you this pamphlet. It's just some information so you can read up on it.
Okay.
All right.
And Miss Rose, would you like us to get a chaplain on board?
Yeah, I think that would be a good idea.
Okay, we'll get that took care of.
So the first process is making your first oral request. This has to be to your physician in the state that you live in, and you must say something along the lines of, I'd like to be a part of the Death with Dignity Act, and there's many ways you can bring it up, but you have to be the one to initiate it with your physician. After this first oral request, they will make note of it in your medical chart and make sure that you request that they do so. And 15 days later, you can make your second oral request or a second written request. In your second written request or oral request, you need to make sure that you have a witness. The written request is a little bit different, and you have to have 2 witnesses. And one has to be someone who's not related to you, doesn't have any sort of stake in your estate after you pass, and cannot be a part of the healthcare agency that you're using to get this prescription. After this second request, you have 48 hours you have to wait in certain states. There are a couple of states that are part of this and a couple that aren't, but after that 48-hour request, your physician is able to make your prescription available to you. And then after you get this prescription, you have to be the one that gives it to you. There are 3 instances in which you're not able to give yourself the medication, such as if you get placed in a coma because your condition has deteriorated. So there are 3 conditions in which you might not be able to give the medicine yourself. The medicine is actually a 4-ounce sleeping aid usually. It's medication mixed together, and you must be able to swallow this medicine yourself. So if you have a condition such as ALS and you're not able to do so, that could be one thing that prevents you. You could also have your condition could deteriorate and lead you into a coma, or if you are no longer mentally sound enough to request this medication, because that is part of the protocol. You have to be able to request the medication and administer it to yourself. This medication works by allowing you to fall asleep within about 10 minutes, and death usually occurs within 1 to 3 hours. Some patients take longer for this process to occur, but you are always comfortable and sleep is constant, so there is no longer pain.
Hey Janie, what's wrong?
Hey, Dr. Haynes. I'm just having a hard time handling this situation.
Yeah, it can be difficult for some people. When I first started practicing, it was difficult for me. As I've done it a lot more, I've kind of just wanted to put the patient's care first and their right of autonomy. And I think she's really thought about this. Seems like she's thought it through, that hospice care isn't for her. We suggested that. Palliative care doesn't seem like she wants to go that route. I don't think she's rushing into this. I think she's really thought about it, and I think it's just one of the best things for her, maybe.
I'm from South Carolina, so it's just not anything I've practiced before. It's just something I take kind of personal. I just don't believe.
Okay, we can get another nurse if that would make you feel more comfortable. If you're not comfortable with doing this, we can get another nurse on the healthcare team.
Yeah, that would be good. Thank you.
So according to Snyder and Mueller, in an article on ethics and legalization of physician-assisted suicide, the main issue with this topic is in regards to the ethics of the process. Most in support acknowledge the right of autonomy as the key factor. The right to decide the time and circumstance around death is very personal, and every competent person should have the right to choose death. It's also a matter of justice. Justice requires that cases are treated alike, and therefore, competent terminally ill patients are allowed to hasten death by treatment refusal. For some patient, treatment refusal can lead to more suffering, and justice requires that we should allow assisted death for those cases. Compassion is another topic at hand. Suffering means more pain. It means more than pain. There are other physical and psychological burdens, such as the burden that the patient takes on their family, and those interfere and make it impossible to relieve their suffering completely. Allowing these terminally ill people to determine the timing and manner of their death is a compassionate response to unbearable suffering. Another issue in this topic of life versus death is the issue of individual liberty versus state interest. Some societies have a very strong interest in preserving life. However, many believe that this interest lessens when a terminally ill patient has a strong desire to end their life. A complete prohibition on this assisted death excessively limits personal liberty and doesn't allow patients to make their own life care decisions. And another important part of this topic is the openness of discussion. When this topic is kind of hidden and secret, Oftentimes this happens in things like morphine drips, and we don't really discuss those kinds of things. However, it is a form of assisted death in many instances. In states without these death and dignity laws, open discussions are avoided and prohibited, and legalization would help promote these discussions. Many against these ideas are inherently against they believe that it's inherently against the traditional duty of the physician to preserve life. So many are concerned that it's an easy way for elderly patients to be abused and to be forced into ending their life so that their families or long-term care facilities don't have to take care of them anymore. And they also believe that it's an issue for mentally incompetent individuals to be forced into death because they could be coerced in some way. Others are also concerned that it could be a legal issue with insurance companies and that it could prevent insurance companies from giving out an end-of-life benefit or an issue with life insurance. Many think it also isn't regulated enough to ensure that those who are making these decisions are of actual sound mind and not influenced by the psychological impacts of the terminal diagnosis. So this topic of physician-assisted suicide is a common topic that brings about a lot of controversy, specifically among healthcare providers. In most states that have the Death with Dignity Acts, healthcare providers are not required to participate in these if it goes against the ethics or morals of them. And this causes a nursing issue for many nurses. Many nurses don't know how to care for these patients, and it takes an emotional and psychological toll on them. Many have prior instances where they've taken care of patients who have passed away and they've just taken death really difficultly, or they have family members who have committed suicide and it's taken an effect on them emotionally. And so it's important to acknowledge that this topic is very sensitive in manner and that it needs to be addressed by the physician and the nurse. So if the nurse is not comfortable with it or the physician is not comfortable with it, they are not required to participate in these cases. It's also a nursing issue, because many think that if your patient is terminally ill and that they are going to participate in this end-of-life decision, that they will no longer get the quality of care that they deserve in the hospital or in a long-term care facility. So it's important to acknowledge that every patient, no matter if they've decided to participate in this Death with Dignity Act or if they're in palliative care or hospice care, that they all receive the same amount of comfort measures and the same amount of medical treatment. In the state of South Carolina, this is also an issue that has not been passed. So an article on the ban on physician-assisted suicide passed in South Carolina. Governor David M. Beasley states, South Carolina is once again a leader in putting life ahead of death and replacing corrupt values with traditional ones. Today's actions say that protecting life, liberty, and the pursuit of happiness is not an outdated notion, thanks to the efforts of many people. In conclusion, physician-assisted suicide, commonly known as death with dignity, is a very controversial topic that must be handled with care. It's important to take care of our patients and give them all alternative measures that they may take to preserve their life. It's also very important to make sure that we take care of our healthcare workers and physicians and nurses to make sure that their emotional needs are met as well.